Hi everyone, so today we are going to look at psychological assessment test revision. I know I said I'd put these past papers in a podcast, but I feel like doing a video. And in this video, we're going to look at what I have found to be recurrent questions, which are components of a psychological report, characteristics of a psychological test, ethical issues in psychological test administration, the 6 essential steps in the development of psychological tests. I've also added my own predictions. When I was reading the notes, I was like, things that are bound to come are assumptions of psychological tests, limitations of psychological tests, uses of psychological instruments. So we start with question 1, which is discuss 5 characteristics of a good psychological test. And because my storage keeps on running out, I'll just go through them briefly. We have reliability, validity, standardization, objectivity, and practicability, which is also called usability. I'd like to say that reliability and standardization are similar. Reliability refers to the consistency or stability of test scores over time or across different raters. A reliable test produces similar results when administered under similar conditions. For instance, test-retest reliability. An intelligence test administered to the same individual 2 weeks apart should produce similar IQ scores if no significant changes have occurred. For instance, the first time they may score 100, the second time they may score 1 or 2. You see, the scores are similar. Validity refers to the extent to which a test measures what it claims to measure. A valid test accurately assesses the intended psychological construct. For example, a depression inventory should measure symptoms of depression rather than anxiety or stress. Standardization. A standardized test is administered, scored, and interpreted using uniform procedures for all examinees. Standardization ensures fairness and comparability of scores. For instance, a standardized test would be one where all the people in the test group are not going to score something that where their scoring is worlds apart. Maybe 2 or 3 people could have very high scores or very low scores, but majority of the population would have similar scores. The Beck Depression Inventory BDI-2 has standardized administration and scoring procedures for all clients. Objectivity. Objectivity means that scoring and interpretation are free from examiner bias. Where if white people do one test and black people do the same test, there really should not be a difference in scoring, so there shouldn't be examiner bias. Then let's look, for example, multiple choice aptitude tests have objective scoring because answers are either correct or incorrect. It can't be correct because a black person said it and incorrect because a white person said it. Practicability, which is also usability. A good psychological test should be economical, easy to administer, easy to score, and simple to interpret while maintaining scientific quality. You cannot go to a Swahili-speaking population and administer a French test. You cannot go to a population, an area that is very far to reach, very far to administer the tests in, and you also need interpreters and not have a budget for that. So those are the 5 things. There's reliability, validity, objectivity, standardization, and practicability, which is also usability. For example, the general health questionnaire can be completed within a short period, making it practical for screening in busy healthcare settings. Question 2, with relevant examples, explain 6 essential steps for the development of a good psychological step. We have step 1 is planning, step 2 is writing items for the test, step 3 is preliminary administration of the test, step 4 is checking the reliability of the final test, step 5 is checking the validity of the final test, and finally step 6 is preparation of the test manual and production of the test. It's easy to remember step 4 and 5 because step 4 and 5 are also the characteristics of a good psychological test. Step 4, validity. Step 4 is checking reliability of the test. Step 5 is checking validity of the test. So in planning, let's read. For planning, it's the first and most important stage in test development. The developer decides on the objectives of the test, age group or population to be assessed, format of the test, which could be multiple choice, true or false, Likert scale performance tasks, method of administration, is it an individual or a group, the scoring procedure, the resources, time, and costs involved. For example, a psychologist planning to develop a stress assessment scale for university student first defines what stress means, identifies its symptoms, determines that the target group is university students aged 18 to 25 years, and decides to use a 5-point Likert scale. if you don't look at least the age, not at least the age, but if you don't look at the age and you just go and give the test randomly, you won't be able to get any valid results. Good planning ensures that the test is focused, scientifically sound, and suitable for its intended purpose. Writing items of the test. While writing items, the developer ensures that the language is appropriate for the target population, questions are free from ambiguity, items cover all aspects of the construct, cultural and gender bias are minimized, the difficulty level is appropriate. Experts in psychology and the relevant subject area often view the items to determine whether they adequately represent the construct, that is now content validity. For example, for depression inventory, an item may state, I have lost interest in activities that I used to enjoy. The respondent indicates how often they experience this feeling. Well-written items improve the accuracy, fairness, and effectiveness of the test. Remember, when you're writing items for the test, you have to make sure that questions are free from ambiguity, and we have to make sure that well-written items are there, because this is what improves the accuracy, fairness, and effectiveness of the test. Step 3 would be preliminary administration of the test. This is also known as pilot testing or tryout. The purpose of pilot testing is to identify confusing or poorly worded items, determine whether instructions are clear, estimate the time required to complete the test, observe respondents' reactions, collect data for statistical analysis. After administration, item analysis is conducted to determine which questions perform well and which ones should be revised or discarded. For example, a newly developed marital satisfaction questionnaire is administered to 50 engaged couples before it is used in churches nationwide. You can't just take your questionnaire to churches without doing all of this. Pilot testing helps improve the quality of the test before large-scale use. Then step 4. And remember I said that step 4 and 5 are easy to remember because those are also two characteristics of a good psychological test. And step 4 is checking the reliability of the final test. After revising the test, the developer evaluates its reliability to determine whether it produces consistent and stable results. And common methods include test-to-test reliability, which was the same example we gave when looking at characteristics of a good test. A test is administered to someone, and after a set period of time, the same test, while maintaining the same conditions, is administered to the same person. If the results are similar, then that test is reliable. Split half reliability. This is dividing the test into two halves and correlating the scores. For example, a maths test could be paper 1 and paper 2. How someone scores in paper 1 is going to reflect how they score in paper 2. Like the results for paper 1 are going to be similar to the results in paper 2. If they're scoring very highly in paper 1, they're likely going to score very highly in paper 2. If they're scoring very low in paper 1, they're likely going to score very low in paper 2. That is split half reliability. Internal consistency reliability. This is determining whether all items measure the same construct, often using Cronbach's alpha. You cannot start measuring for depression and then you have anxiety questions being measured in there. You cannot be measuring for narcissistic personality disorder, but then you have questions for histrionic personality disorder in there. Inter-rater reliability. Assessing agreement between different examiners when scoring subjective responses. This is kind of like being peer reviewed. How I would set the test is not how other people would view it. Like I set the test and I give other examiners to now rate the reliability of the test. You really need the input of other examiners. You can't do this alone. For example, if a personality test produces similar scores when administered 2 weeks apart, it demonstrates good test-to-test reliability. This is important because reliable tests produce dependable results that professionals can trust when making decisions. That is the importance of pilot testing. Then step 5 is checking the validity of the final test. Validity determines whether the test actually measures what it is intended to measure. Even a highly reliable test is of little value if it does not assess the correct construct. Different types of validity include content validity, criterion-related validity, construct validity. Content validity. Experts determine whether the items adequately cover the construct, like the content of the test. Is this content enough? Is it adequately covering the construct? For instance, if you're trying to test a narcissistic personality disorder, you really need to look at the DSM-5 TR and see if you're meeting the criterion in narcissistic personality disorder and if it's in that test. That's now the content. Criterion-related validity, comparing test scores and other established measure or outcome. Construct validity, determining whether the test accurately measures the theoretical concept it was designed to assess. If validity studies reveal weaknesses, additional revisions are made before the test is finalized. And a good example, according to me, would be the WISC, which is the Wechsler Intelligence Scale for Children. It has 5 versions, because now we're at WISC 5, which was created in 2013. It was WISC, the first one, then WISC R, which would have been Wechsler Intelligence Scale for Children revised, then WISC 2, 3, 4, and now we are at edition 5. Finally, preparation of the test manual and reproduction of the test. Once reliability and validity have been established, the test is finalized and prepared for professional use. A comprehensive test manual is developed to guide users in administering, scoring, interpreting, and maintaining the test. The manual typically includes the purpose of the test, the theoretical background, instructions for administration, scoring procedures, interpretation guidelines, reliability and validity evidence. Very, very important to have that evidence in there. Normative data, ethical guidelines and limitations. Whatever you do in psychology, you must follow the ethics, you must have ethical guidelines, and you must also mention the limitations, the ethical limitations. The final version of the test is then reproduced and distributed for use by qualified professionals. For example, the manual for the Beck Depression Inventory provides detailed instructions on administration, scoring, interpretation of scores, normative information, and supportive research. It's important to create this manual because the test manual promotes standardized administration and interpretation, ensuring that the test is used consistently and ethically across different settings. I have a table that summarizes the step and the purpose. It's going to be linked in the description box below. As usual, I put those templates on Canva. And then we want to look at characteristics. We've already looked at characteristics of a psychological test. We've looked at components. No, we haven't looked at components of a psychological report. So that's what we want to look at. Now, I want to look at the components of a psychological report. Explain the essential components of a psychological report. We have identifying information, reason for referral, background information, assessment procedures, behavioral observation, test results, interpretation, diagnosis, recommendation, summary stroke conclusion, and finally your signature. So the identifying information includes the client's name, age, gender, date, and referral source. And then we have the reason for referral. I'm not sure referral source should be up there, but reason for referral, which explains why the assessment was requested. For example, assessment for learning difficulties. Then we have background information, which includes medical history, educational history, family history, social history, mental health history. Assessment procedures, this lists all tests and methods used. We have like the clinical interview. If you are testing for depression, you probably have the BDI-2, Beck's Depression Inventory. If it's anxiety, Beck's Anxiety Inventory. Maybe you also have a projective test in there, like what's this one called? The House 3-person test. Then also you have the mental status examination, MSE, and assessment procedures. Then behavioral observations. This describes the client's appearance, mood, attitude, speech, orientation, speech, cooperation, attention, and behavior during assessment. Test results, presents scores and explains their meaning. Remember in step 4 we had assessment procedures. So the assessments that were done there, here you come and put the test results. Then interpretation. This integrates findings from interviews, observations, and test results into a coherent psychological understanding. Diagnosis, if applicable, provides a diagnosis based on the DSM-5 TR or ICD-11. And I'm saying ICD-11 in italics if needed. Recommendations, this provides evidence-based interventions. For example, could it be this person needs individual psychotherapy, maybe they need family counseling, them and the people need family counseling, school accommodation, psychiatric referral, follow-up assessment. Summary stroke conclusion provides a concise overview of the major findings and recommended interventions. And then now we look at ethical issues in psychological test administration. I believe I've seen that question up here somewhere. So yeah, examine 6 ethical issues that would guide you in administering assessment. So ethical issues are things like informed consent, confidentiality, competence, cultural awareness. Informed consent, confidentiality, competence, appropriate test selection, cultural fairness and non-discrimination, accurate interpretation, and feedback. Informed consent is where you really need to let the client know why we are doing this test. So clients should voluntarily agree to assessment after understanding its purpose, risk, benefits, and procedures. You need to put all that out there. Confidentiality. Assessment should remain confidential and only be shared with authorized individuals. Even if you've not yet scored the test, the information in the test should never ever get into the hands of an irrelevant person. Appropriate competence. Psychologists should administer only tests for which they have appropriate training and qualifications. You cannot start administering the Minnesota multiphasic MMPI inventory when you don't even know how to administer it. You've not been trained in it. MMPI, Minnesota multiphasic inventory. Yeah. You cannot be administering that if you're not competent in administering it. Appropriate test selection. The chosen assessment should be suitable for the client's age, culture, language, education, and presenting problem. You need to be very careful what test you're administering. Do not just administer a test because somebody looks like, oh, there are textbook definition of this and that. You can't just give people a test because of your own biases. Cultural fairness and non-discrimination. Tests should not disadvantage individuals based on race, gender, disability, religion, or culture. Disability is where inclusivity is very important. If somebody is unable to see, you need to ensure that the tests you're giving have braille. Or at least maybe they can see, but then their vision is very limited. There needs to be someone over there who reads the test for them, reads the test questions for them. Accurate interpretation and feedback. Actually, nowadays, because of technology, you can get a test which is either written, audio, or visual. Accurate interpretation of feedback. Results should be interpreted using professional standards and communicated clearly and sensitively. Clients should understand their strengths, limitations, diagnosis if appropriate, recommendations. Now, something else in accurate interpretation and feedback, you're not going to give the client like the raw test for them to see. In case they ask for the records or you're supposed to give them the test results, you're supposed to rewrite them in a way where the client is not going to pick the information on the test and label themselves. Because clients will honestly own their results. They will own their results and they'll start making excuses for their behavior, or they'll get into learned helplessness or some self-defeat. So we've looked at components of a psychological report, we've looked at characteristics of a psychological test, we've looked at ethical issues in psychological test administration. We've also looked at the 6 essential steps in the development of psychological tests. Now we're going to look at my own predictions. I feel like these are the things that are going to come. I really wrote a lot. Like I said, assumptions of psychological tests. In psychological testing, there are 3 basic assumptions. People define important traits. We can quantify. Okay, the papers are done. We're now going to look at my own predictions. And according to me, we have assumptions of psychological tests. In psychological testing, there are 6 basic assumptions. People define important traits. We can quantify these traits. The traits are reasonably stable. Measures of the traits relate to actual behavior. Testing and assessment can be conducted in a fair and unbiased manner. Testing and assessment benefit society. Then we have limitations of psychological tests. We have test construction. We have cultural bias. We have accuracy. We have interpretation. We have uses of psychological instrument. To be able to gather enough information on the client and client's issues, understand clients better, which is help in making informed decisions about people, confirm diagnosis, help in treatment planning and recommendation, psychological research. And then I also said we're going to look at the difference between behavior techniques and objective techniques. So behavior techniques focus on observable behaviors and context. Objective techniques focus on measurable and quantifiable data, e.g. scores responses. Behavioral techniques assessment is typically more individualized and context specific. In objective techniques, assessment is more standardized and generalized. In behavior techniques, they are commonly used in behavior therapy, educational settings, and developmental disorders. Objective techniques commonly used in cognitive, clinical, and personality assessment. Behavior techniques data is gathered Data gathered is often qualitative, focusing on frequency, intensity, or duration of behaviors. And then in objective techniques, data is quantitative and compared against norms or benchmarks. In behavior techniques, they may require subjective judgment in interpreting behavior. In objective techniques, typically less subject to subjective interpretation, as scoring is fixed. Yeah, and that's all, but I'm still scrolling here and I'm trying to see. Yeah, there's here what reasons for using a projective test. You have exploring unconscious conflicts, assessing personality, working with children, when clients have difficulty expressing feelings, complementing other assessment methods. And then we've already done ethical issues. We want to look at something about cognitive. Let's see, the question about things that influence cognitive something. Actually, I've just seen here in the questions, discuss 3 limitations of psychological tests. And here I was saying limitations of psychological tests might come. We have cultural bias, we have measurement error, we have limited scope. We also said, what was it called? Interpretation of the tests. Then we have goals of psychological assessment. We have diagnosis, treatment planning, prediction, monitoring progress. I feel like this is similar to uses of psychological instruments. I've written here from notes to diagnose mental health conditions and identifying troubling behavior, to better understand a person's strengths and weaknesses, to identify potential problems with cognitions, emotional reactivity, to make recommendations for treatment, to assist in academic or career placement. Then there's something about things that influence cognitive, factors that influence cognitive abilities. We have genetics, we have environment, we have health and nutrition, we have age and development.